Welcome. Dr. Morse here. Let's talk about a fascinating topic here in the 8th episode of my brand new podcast, Eternal Vitality. Today we're going to talk about anti-aging and some of the different supplements and devices we can use to help us slow down or possibly reverse our aging, as well as help some of the other different diseases that we associate with aging. Now, I happened to just do a full presentation on this a couple days ago at a conference called the Global Federation Conference. It was a longevity conference. And I'm going to use my presentation to kind of walk you through what I'm thinking and what I've seen and what the data starts to show. Now, if you haven't been here before, thank you for joining me. Do me a favor, if you like this type of content, hit the like button, consider subscribing, as well as consider checking out some of the other episodes. We've talked about PRP, we've talked about America's healthcare system, we've talked about methylene blue, we've talked about ketamine and how it can be useful for depression. We have all different types of discussions, and I try to educate and provide a different mindset, different viewpoint for a topic and more of an in-depth discussion. Some of them will be just myself. Some of them will be bringing in different experts. I try to record these weekly and get them out to you every Monday morning. Right here, I'm actually at our Jacksonville office at the Osteopathic Center. So I needed to record this in my hotel room. So here we are. Traditionally, I'm either at the office in the Miami office or at home. So let's get started. We've seen longevity and anti-aging medicine start to make some leaps and bounds over the past couple of years. There's been a lot of money, billions and billions of dollars starting to be put into many of these different drugs and testing to see if we can figure out how to live a longer, healthier life. You know, the lifespan is about 70 to 75 in most of the parts of the world. And ideally, we're trying to, stretch that longer and longer. I saw a statistic the other day that said there's about 575,000 centenarians throughout the world, meaning they lived to over 100. And that's really without implementing any of these anti-aging protocols, and that's even with our currently poor diet. So imagine what we can do if we tweak some of these small things. We can make this so much better and live a healthier, happy life into our hundreds, or potentially even to our 110s or even 120s. I think that is pretty realistic. Some people may say I don't want to live that long, but if you are healthy and you have something to live for, then that is something that we want to be able to potentially provide to you. So how do we potentially slow down aging? Now there are many different places to start. I'm going to predominantly talk about peptides today, which are either oral or injectable small proteins that we usually get from pharmacies, compounding pharmacies, although you can get them online sometimes. Sometimes they are considered supplements as well that do something in the body that is basically forming a reaction that can help to do different things depending on what exactly the peptide is made out of and what its function is. Now, in addition to peptides, we have something called bioregulators. We have different therapies that help to address DNA damage. We have something called senopreventatives and senolytics. We have an important class of genes that really help to control our aging called sirtuins. And there's different therapies that you can use for that. There's a relatively new and emerging field within anti-aging called clothotherapy, and that also is becoming more fascinating to see different things that can help with that. And then we have something called V cells, VSELS. These are very small stem cells that you can extract and potentially re-inject into the bloodstream to help with aging. Then we have biologics, we have exosomes, which are some consider a type of stem cell. I consider it a growth factor. And then we have, photomodulation that can help different things. So you'll see this PowerPoint kind of pull up, and you'll hear me talking in the background, kind of walking you through this. Now, this is one of my favorite slides. I'm in the process of building a beautiful supplement that has as many anti-aging and all natural extracts in it that I can find, that I can get in a pure source. And you can see here there are several different things that can help with DNA damage repair, that can help what we call prevention of what we call the epigenetic drift. We have two types of genetics. We have our traditional genetics that we were born with, and that controls about 20 to 30% of our aging. But what we really are impacted by is what we call our epigenetics, which is essentially what our lifestyle is, our food that we eat or don't eat, exercise, different supplements, how healthy we are, all these different things that impact our life. There's actually a fascinating study from Northern Europe that evaluated biological twins over the course of their life to realize that epigenetics was a much more of an important factor than genetics themselves. So we're looking at about 70, maybe close to 80% of the impact of our lifestyle and our epigenetics is having on our aging. Now, the list that we have here includes peptides, includes methylene blue, which was on my last episode, cat's claw. You have an N-acetylcysteine, something called sulforaphane, which is basically broccoli seed extract. You have melatonin, like the one our body builds, but uses a super therapeutic dose. We have one of my favorite supplements, curcumin. We have NMN or NAD. We have berberine, which is a natural form of, or something similar to metformin. We have resveratrol, which most people usually associate with red wine or the grapes. We have lactoferrin. We have astaxanthin. We have urolithin A. We have ECGC, which is a green tea extract. And then you have a couple of different telomerase activators, some bioregulators, and then the what we call the SIRT6 modulators, which include one of my favorites, which is fucodan, which is essentially kind of like a Japanese seaweed that helps with lumbar kinase is one of them. There's different ones that can help with some anti-aging properties. So let's transition peptides. So peptides are basically small proteins that are about 2 to 50 amino acids in length. They're not quite a full protein, but they are small pieces of basically mini proteins. And there have been over 7,000 peptides identified. Many of them have been identified in our body. Insulin is a perfect example of one. There are several that have become popular and even become drugs. The popular drug Ozempic is actually a peptide and has been a peptide for many years. It was basically slightly modified and then trademarked and then underwent trials and eventually came out and became the drug. So there are many different peptides that have fantastic functions that you'll hear about and that you'll see about. I did a separate video, I think it was video 2, that talked about peptides, and another really good peptide that we'll talk about today called BPC 157 that does a lot of good healing. Now, this is going to be more of an overview to build a personal anti-aging protocol like I have in my practice. You have to kind of figure out what's going on in their body. What are their toxins? How fast are they aging, or something called the Dunedin pacing scale. What do their chromosomes look like? What are their telomeres like? How long are their telomeres? And that's the end of your chromosome, and that will give you a gauge of how quickly they are aging. The shorter that chromosome length, the faster they're quote unquote going to die. So if you can potentially slow down that chromosome length, then you could ideally add life or healthy life to that person. The majority of the peptides, the primary goal is to regulate gene expression and protein synthesis. Now, there's many different types of peptides and what they do. Many of them control a vast number of cellular pathways and functions, including affecting the mitochondria, what we call cell senescence, which is basically like the dying of kind of cells. I like to think of it as a car on a highway just kind of dying, and then nothing ever moves that cell. It becomes what we call a senescent cell, or kind of a zombie cell, and now it's causing all this backup to the rest of the highway or the bloodstream or the cell or wherever it's in, because the body doesn't know how to get rid of it. So it's just causing all this backup and issues. Now, you have the peptides that affect hormones, you have peptides that affect growth factors, brain neurotransmitters, even antimicrobial immune function, which is one of my favorites, as well as metabolism. We're going to talk about several different peptides right now that will affect many of these different categories. Now, these work primarily through intracellular and intercellular, or within the cellular signaling, which then helps to lower the side effects. Now, there's a bunch of different uses for peptides. I would say one of the most common is for anti-aging, which is what we'll focus on today. You also have skincare, immune support, performance, namely sports performance or healing from musculoskeletal injuries. You have the bodybuilding approach, hair loss, weight loss, sexual dysfunction. You can do what we call biohacking, which is basically kind of testing things out in you to try to optimize your body function. So many different people do that. And it's important to understand that peptides need to be getting from a good source. They really should be reconstituted with sterile water, or with something that was provided with the peptide, and they need to be refrigerated. It is important to what we call cycle these peptides. So a common approach would be 3 months on, 1 month off, to prevent desensitization. And then ideally you optimize micronutrients to optimize the efficiency of that peptide. And you really need to make sure you understand where the peptides are coming from, that you have an expert helping you, and that you're just not randomly finding them on the internet and you don't know what you're putting in your body. So it's important to find a peptide specialist, an anti-aging specialist, a longevity specialist that is going to help you age gracefully, help with your hormones, and help you live the longest, healthiest life that you can. And you think, well, I won't worry about this until I'm 40 or 50 or 60. And unfortunately, that's almost too late, because it's very difficult to reverse things at that age. You'd rather address it in your 20s and 30s and then just live optimally for the rest of your life. And the cool thing is we will have amazing new things coming out over the next 10, 15, 20 years as we start to get more research back and continue to modify all that we know now, and we're going to be even better. So we're just at the forefront of aging right now, and any of the anti-aging and longevity field. Addressing the mitochondria is one of the most important and one of my favorite things to do, because this is really the cell that runs the show. So without this, you're going to have significant issues in your body. A lot of people who are very sick have poor mitochondrial function, which is part of the reason why they're sick. Their body's not able to get rid of all these different toxins, and they start to build up and cause problems, whether that's autoimmune disease, whether that is any number of different infections that may be causing chronic issues, slowing down your metabolism, slowing down your immune system or your thyroid function, or completely stopping and maybe causing cancer, or not being able to regulate cancer cells in your body. Now, there's a couple different supplements that can help with optimizing mitochondrial function. Many of these are my favorite, and I take them daily personally. That includes berberine, resveratrol, NMN or NAD, curcumin, and another one is PQQ. Now, there are a couple different mitochondrial peptides that I'll mention today, one of which is MOTC, and another is SS31, and we'll go through those in a little bit. So this is a good slide to kind of summarize all the different peptides and how you can approach longevity. You have DNA damage in addressing telomeres, which is more of an heptathlon, or a GHK, which is a copper peptide. You have ones that help the pineal gland and the thymus, which is predominantly immune function. That's thymosin alpha, thymosin beta 4, epitaphlon, and then you have some secretagogues as well as BPC. You have latent viral therapy, which basically means you're addressing chronic infections like CMV or EBV or herpes, any of the herpes viruses, and there's a correlation with aging with those. That may be LL37, which is becoming very difficult to get, along with BPC as well as thymosin alpha. Mitochondrial peptides, as we mentioned, we can add CJC-IPA as well as sermorelin and epitaphlon. Telomere length, as I mentioned a little bit ago, epitaphlon or pinealon, both have a tendency to address this, and a senolytic agent, something called FOXO4 DRI, which is quite an expensive peptide, can be helpful for that. Now, the majority of the ones we will focus on today are the anti-aging ones, namely BPC, GHK, thymosin alpha 1, beta 4, as well as MOTC, sermorelin, 5-amino-1-QM, dihexa, and cerebral lysine. There's a couple kidney and heart focused peptides. This is more just for information in general. Thymosin beta 4, heptathlon, SS31, and BPC all seem to both help the same too. The brain and pineal gland is BPC and heptathlon or pinealon, and then the muscle is more CJC-IPA, BPC, MOTC, and something called MGF. Now, the top ones I just mentioned is this slide right here, and we will go through these in no particular order, starting with my favorite, BPC, which unfortunately has become very difficult to find in the injectable form, as the government makes it a little bit more challenging because they turned it into a class 2. Now, this stands for body composition factor 157, which is originally found in the gut in 1993. It is a fantastic healing peptide. It is very safe. I spoke about this at length in the second podcast episode, but I'm going to kind of briefly review it here. From an anti-aging perspective, it does many, many different things. As you'll see on this slide right here, BPC 157 is kind of the jack of all trades. It helps with musculoskeletal, which is the most common, but also helps with aesthetics, with muscle health, with sexual performance, with neuroregeneration of the brain, with sports performance, with heart, as well as with anti-aging. It's the only peptide, to my knowledge, that does all of these things, which is unfortunate why it's becoming very, very difficult to get. Now, how do we use it for anti-aging? So we're going to use this to help with reverse the loss of the angiogenesis, or the poor blood vessel or lack of blood flow of aging. It is an anti-inflammatory. It helps with tissue injury, and it also helps to repair tissues. So that's important to understand that, you know, our shoulders, our knees, our hips, our back, these have a tendency to get beat up over the years. And if we can't have these doing well and healing, we're not going to be feeling very good when we get older. So we need to make sure that these different muscles are optimally functioning, and this is something that can help with that. Now, you know, dosing, this is predominantly, the one I predominantly like to use is subcutaneous. You can do it twice a day. The next peptide I really want to talk about is called GHK. This is a copper peptide that's naturally found in the saliva, the urine, and the plasma. It naturally declines with age, which kind of gives you a correlation. It was initially discovered in the 70s, became more popular in the 80s when it was added to skincare products, and eventually becoming more and more. This has a bunch of cool properties. I'm not going to go through this one extensively because this one's complicated, but it does have ability to up and down regulate a significant number of human genes. It can help with even repair genes. And it has the ability to address DNA damage. We've seen some anti-cancer activity, which is pretty cool. And it binds, and when you have an acute wound, you have inflammation that binds to copper. and the GHK-Cu switches the inflammatory process to a regenerative process or a healing process, which is amazing. And also helps with tissue remodeling. Now, it's best used for longevity, in my opinion, with like resetting the human genome, helping repair DNA, as well as repair misfolded proteins, and I mentioned that anti-cancer activity. Now, one of my favorite peptides, also becoming more difficult to get, is what we call TA1 or thymosin alpha 1. This is a initially found from the thymus of a calf in the 1970s. It is rapidly absorbed. It helps to boost the immune system by basically enhancing T cell, dendritic cell, and antibody response. And it modulates what we call the cytokines as well as chemokine production. It has a ton of uses. It can really help many, many different things. It is predominantly responsible for regulating and modulating immune function. And it helps to basically optimize your immune system. We can use it for chronic fatigue, for autoimmune, for Lyme disease. We've seen it for HIV and many other different diseases. Now, the important thing to understand here is that this actually helps to resensitize your immune system from a antibody dominant T helper 2 system to a much more important and sensitive natural killer dominant T helper 1 system, which basically means you are less dependent on antibodies, and you can fight things immediately when you see them in your bloodstream and in your body. And that helps, in my opinion, to prevent autoimmune disease. You have all these antibodies created, which then start to attack everything, and then the body sees everything as an invader. And you want to kill these things that are actually should be killed early on, and that's why we need to shift that immune system from a T helper 2 to a T helper 1. Now, as you can see here, there's a ton of different actions. It can help in many different ways. We've seen that as the thymosin alpha 1 levels decrease in the body, or the typical symptoms of aging have a tendency to increase. This includes loss of motivation, physical energy, fatigue, increased pain in the soft tissue and joints, issues with the immune system, and slow wound healing. So you can imagine raising this back up can significantly help. We can use thymosin alpha 1 to boost the immune system, to modulate that T helper 1, T helper 2 system, but it also helps to provide a general sense of well-being. Now, thymosin alpha 1 is predominantly an injectable. Most people are going to do it daily or most days, and then take about a month off. Now, thymosin beta 4 is kind of thymosin alpha 1's cousin, and not exactly, but they work a little similar. Some people also call this TB500. This is sometimes combined with BPC to form what we call the Wolverine protocol, which is, as you can imagine, ultimate healing. Now, thymosin is a hormone that's secreted by the thymus. It is the primary function to stimulate the production of what we call T cells, which is basically what modulates the immune system. This also helps to indirectly develop antibodies, and this is the most predominant form. This does play a massive role in tissue repair, and this gene is actually the first one upregulated after injuries. That gives you an idea. The body senses an injury. The first thing it does is it tells the body, hey, go turn on thymosin beta 4. Pretty important. Now, it has 43 amino acids. It's pretty much available in all cells except for red blood cells, and it has some amazing modulation of immune system as well as growth factor properties. It does all of these things on the screen right here. You can see angiogenesis. You can see it regulates fibroblasts, which help decrease scarring. It down-regulates something called PDGF, and improves the ratio of CD4 to CD8, which is an immune system thing. It can help with stem cell activation and movement of them. It's an antimicrobial. It can help kill some of those zombie or senescent cells that I was talking about earlier. It's also a massive anti-inflammatory, which is inflammation is usually the culprit of most diseases and aging in general. So very potent, very effective peptide. You can use this as a senolytic, which It basically means an anti-aging unit. It also withstand wound healing, with cardiac protection, especially after a heart attack. Help with liver and kidney function, autoimmune. It can help with hair restoration. It can help with the brain, and as mentioned, commonly combined with thymosin alpha 1 for immune system. I won't go into this slide because it's quite complicated. This is predominantly an injectable again. Often we do this for 3 months on, 1 month off, and there's different protocols depending on what you're trying to do with it. Now, epitelon is actually a peptide that I just personally completed. There's another version of it called pineolon. It's very, very similar. And this is essentially helps to increase a person's ability to resist emotional stress. So it kind of keeps you cool, calm, and collected in stressful situations. Wouldn't we all like to have that? It also helps to normalize the cholesterol, the uric acid levels, and prolactin levels, and it can potentially restore pancreatic hormone function, which is where our insulin is made, which means that it can help us maintain insulin sensitivity, which is what we traditionally have a tendency to lose, especially as we gain weight. This is basically helping to prevent diabetes, which is pretty cool. Now, this actually has some amazing properties, including suppression of tumor development. It can help to restore our normal, what we call cortisol curve, which is our stress hormone. It can help with DNA damage. Most people consider it one of the only peptides, or the only peptide, that can help to quote unquote lengthen telomeres. And it can also help to restore what we call the pineal function, pineal gland function, which shows a lot of different hormones in the body. Now, there was a fascinating study that showed 79 people, about half of them had regular just therapy, and the other half had regular therapy plus epitaphlon. And over the course of 3 years, they received one half of the people got about 6 courses of epitaphlon, and they noticed that that group that received the epitaphlon had significantly lower mortality rate. Had patients, they had decelerated aging of the heart. They had less issues with physical endurance as they got older, and they were able to normalize their circadian rhythm in terms of melatonin production, which is helping to sleep, as well as carbohydrate and lipid metabolism. So that's a pretty significant change just from one injectable, about 15 to 20 days, every couple months, so to speak. So that's a pretty significant change, a pretty cool study. Now, they do make this in an oral version. Most commonly it is injectable, but you do make it in an oral, and there's different things for that. We're going to head into the mitochondrial peptides now. These are really fascinating. The mitochondria, as I mentioned earlier, is vital. These predominantly help with weight loss, longevity, as well as energy. This MOTS-c is found in the system already, and it helps to kind of help the body's stress response or metabolic stress response. It allows the peptide to promote resistance of metabolic stress, and it helps to decrease insulin resistance by increasing the GLUT4 uptake in muscles, which is very, very helpful. MOTS-c is it does some crazy stuff. I don't want to get too deep in the weeds here, but it has the potential to help with diabetes, obesity, aging, which are all super important because each of them have a tendency to age us faster. Now, this one is fascinating because by the age of 70, our body has 70% less MOTS-c. So that gives you an idea that as we age, we are starting to lose MOTS-c, which indirectly is responsible for causing us to age. Kind of giving you an idea of how important it is. MOTS-c increases is actually naturally increased during exercise. You especially hit and improves during physical performance, and we saw in young mice. Regardless of the diet of the mice, we saw an increase. You have, regardless of age, you saw an improvement in the mouse when on MOTS-C, which is kind of fascinating. It can help to prevent metabolic disorders, which is essentially diabetes and the like. And it helps to kind of promote a balance between the metabolic balance between for insulin sensitivity, which is really what we need to keep us. Now, there's a fascinating genetic link here because there is actually a polymorphism at the 1382 gene where we see an allele that we prefer the A allele over the C allele, and either you have this or you don't. So if you have it, consider yourself lucky. But we've seen that people have higher muscular strength, and the C allele frequency seems to be overrepresented in sprint and power athletes. So it is a fascinating thing that they discovered. The MOTS-C regulates aging and metabolism. You can see that as we had more MOTS-C, the lifespan and had a tendency to extend. As I said, resistance training helps with MOTS-C. This is an injectable, and you can do it actually after a workout, and it will have different effects than if you just do it in the morning. This is there's a couple different versions of this one. I chose to speak about sermorelin versus, say, CJC, ipamorelin, or tesamorelin. These are all different versions of growth hormone peptides, and growth hormone is very important to aging. Human aging is accompanied by a decline in growth hormone, and we call IGF-1. Ideally, if you can optimize your growth hormone levels as you age, you will age much more gracefully. Although isolated or unabated growth hormone level can cause a lot of issues. So you have to kind of know when to tinker with it and what levels to play with it. This can help also by promoting a healthy immune system, improved hormone balance, enhanced energy, which thereby helps to burn fat, increasing lean muscle, improves quality of sleep, and enhances memory and sex drive. Pretty amazing combination of options there. This one is traditionally done at night because that's when it helps to impact the natural cycle of growth hormone by itself. It helps to stimulate the pituitary gland during REM sleep. Most people are doing this 5 nights a week. There is an oral troche, but it is taken daily as opposed to only 5 days. One of the meds that I don't use a whole lot, but I might need to start, is something called 5-amino-1-MQ. This is actually an oral medicine, and it activates the SIRT1 gene called the longevity gene. It can also help to prevent the development of fat and for type 2 diabetes, so it's helpful weight loss. And it has the ability to potentially reverse obesity and improve athletic performance and overall health. This is one of the ways it does it by increasing intracellular NAD and something called SAMe through the NMT receptor. And this is a complicated slide showing you kind of how it works. Very cool peptide. And there's not too many that are oral, so it's nice when you can find one. This 5-amino-1-MQ helps to promote repair at the mitochondrial level. It increases your basal metabolic rate, which is basically how much energy you need and how much energy you burn, just being awake. And if you're trying to lose weight, that's exactly what you want to do. That's basically your metabolism. Lower cholesterol, it helps to fight inflammation. It has the ability to activate stem cells, which is pretty cool. It also can slow down degeneration of the brain and may have some anti-cancer activities. It has, without kind of going into the weeds here, 5-amino-1-MQ helps to boost the activity of what we call satellite cells, which are very important for healing muscle and growth. As a result, these enhance the ability to repair and replace damaged muscle fibers, which help combat the muscle loss, which is commonly associated with aging. Now, there was a study that kind of showed this, regardless of how beat up the mouse was, giving them 5-amino-1-MQ significantly helped improve both their muscle and cardiac function. And it also increased the lifespan of the mouse. This is an oral pill, as mentioned. Most people are going to take 3 capsules daily, and it can be taken for 2 to 3 months at a time to help with optimization. Now, there's only a couple left. Dihexa is going to be one of them. This was found by a neuroscientist at Ohio State. It has the potential to really help with cognitive function and promoting neural protection, derived actually from angiotensin 4, which is a potent vasoconstrictor. It enhances the acquisition, consolidation, and recall of learning and memory. It's 7 times more potent than BDNF for neurotropic activity, and helps to repair the brain and nerves in a neurological disease. So we're thinking Alzheimer's, Parkinson's, any of these. So this is very, very amazing, because despite all of the amazing meds we really don't have a good solution for your Parkinson's, for your Alzheimer's, for all these neurological disorders. This one has the ability to help with cognitive enhancement, with protecting the brain, even with stroke recovery, neurological disorders, as well as the ability to penetrate the brain. Now, there are studies that show this helps to activate a specific type of cell in the brain, which then helps to reduce the levels of inflammation, and then increase the cells that fight inflammation. It also can activate a specific pathway called the angiotensin 4 PI3K-AKT axis, which is potentially being used to target Alzheimer's disease, which would be really cool. Now, this has pro-cognitive and anti-dementia properties. So I think most people should probably be taking this, assuming that there are no significant side effects. It does this by binding to something called HGF in the brain. It's oral, and you really only have to take it once a day. Now, cerebral lysin is the last one we're going to talk about. This is a nootropic that actually has multiple small peptides that is neuroprotective. It penetrates the blood-brain barrier and actually has the ability to reach neurons directly. It is a injectable, usually given over a 40-day course. It helps to improve the efficiency within the brain's aerobic metabolic process, and it has neuroprotective properties, helping basically the neurons or the brain cells from lactoacidosis, as well as prevent the formation of free radicals, which cause significant harm to the brain. This specific one has the potential to help with Parkinson's, Alzheimer's, multiple sclerosis, ALS, which is Lou Gehrig's disease, the TBIs, which are either significant traumatic brain injuries or sometimes referred to as concussions, as well as stroke. Now, cerebral lysin, this one kind of gets complicated. They did a fly study that looked into it. We need to do more studies about this one, but there's an intranasal version of this that showed that had multiple different benefits. This was specifically in mice. Here's again is a summary of the different peptides we can use for anti-aging, including BPC 157, GHK-Cu, thymosin alpha 1, thymosin beta 4, epitelon SS31, MOTC, sermorelin, 5-amino-1-MQ, dihexa, cerebral lysin, and FOXO4-DRI. There's more than that, obviously, but these are the main ones that are kind of focused on. I'm going to finish up with how to evaluate aging. Like how do we evaluate where we're at, what we call our biological age versus whatever number we are, whatever year we were born. Now, one of the ways is to check telomere length, and the goal is ideally to slow it down or stop or potentially reverse aging. And there are easy ways to check this. This is a simple blood test. I just done mine a couple months ago, and we've seen patients that got it evaluated, that were able to implement some therapies and then check it again, and we were able to lengthen or quote unquote tell the body, hey, you were this age, and now your body thinks it's a younger version of itself because of some of the changes you implemented. Epigenetic testing. This is my favorite one, actually. This is called OMICM. This is actually a test by True Diagnostic out of Harvard. It has a epigenetic reversal we've seen from one patient dropped from about 57 years old to about 53 based on implementing some changes. So again, slow, stop, reverse aging if possible. Now, one of the things I mentioned earlier that we can do is our body has the ability to age at certain rates. There's as slowly as 0.6 years and as quickly as 1.4 years. So basically that means that you can be aging 60% slower than the average person, or 40% faster. And that's the whole range. So say your Dunedin score, I think mine was 0.8. That means I'm for every year I get older, I only age about 80% of that. So I get 3 or 4 months extra. If I do that every year, eventually I'll be making great progress. The fastest you can do is that 0.6. Now, we've been able to implement some of these different protocols to lower that aging, you slow down that aging and help you live a longer, healthier life. Now, that's all I have for you. I hope you found that fascinating. This is a little bit off the beat topic, but I hope that you found it interesting, found it informative. This was all research-based. This is backed. This is not just random thoughts. And if this is something that you're interested in, I have plenty more coming. I have different things. We have different protocols at the office, at the Osteopathic Center. And realistically, we can help to get you feeling better, slow down your aging, and really help you live a longer, healthier life. And it's never too late to start implementing some of these. You don't have to do all of these. You can just pick one. You can just start some of the supplements that can help with aging. You stop eating seed oils, stop eating poor quality meat, and stop eating gluten, especially in America, and pesticides in all of our foods. All of these things are aging us very quickly, and causing obesity and indirectly causing a ton of inflammation in the body. I will ask if you found this fascinating, do me a favor and send this to your friends, to your family, to your colleagues. Share it on social media if you felt like it was helpful to help spread the word. This is a relatively new podcast, and I'm trying to help grow. If you liked it, do me a favor and maybe consider a 5-star review so that we can get this higher up the boards. And we will see you next week with another podcast episode. Thank you very much. Take care.